Hello, I'm Siobhan Hardy, and today I'm in conversation with Ridwaan Omar, partner at Forbes Solicitors, and we're going to be looking at health and safety prosecutions against public bodies over the last 18 months to give you some insight into what that might mean for you and your organisations. Health and safety enforcement action by regulatory authorities has always played a key role in changing behaviour of organisations. The message really has to come from the top, from the executive and senior management team. The Health and Safety at Work Act 1974 has stood the test of time over 47 years and is equally as important today as it has ever been. So, Ridwaan, generally, what types of prosecutions have local authorities faced over the last 18 months or so?
The HSC have prosecuted for incidents arising from failing playground activities, activities on school premises, employees developing occupational diseases, and highway-related incidents. So
what can you tell us that local authorities can learn about the playground incident that you mentioned?
Well, in that particular case, a council was prosecuted following the tragic fatal incident involving a 5-year-old who died when playground equipment collapsed on her due to being rotten and unsuitable. The underlying cause was a failure by the council to ensure annual safety checks were carried out and having no system of inspection in place. The council in that case received a substantial fine of £330,000.
Substantial fine indeed. And you also talked about highways related incidents and health and safety prosecutions there. We've acted for highways authorities for years on civil liability claims, but what lessons can be learned from a regulatory perspective?
Again, there have been several reported cases. One prosecution involved a large branch falling, striking a moving car, injuring a pregnant driver who then sadly lost her baby girl after emergency cesarean delivery. It was actually found there was a failure to inspect trees, manage the risks from falling trees. There'd actually been a similar incident on the same road 7 months earlier, which had not addressed the issue. The council actually received a £100,000 fine and ordered to pay £50,000 prosecution costs. Other another incident where the council was sentenced to a fine of over £1.5 million when a bollard fell as a child went to leapfrog it, causing the child life-changing head injuries. The loose bollard actually had been reported to the council before the incident, but not repaired by the date of the incident due to budget restraints. There was a critical finding by the prosecution that highways inspectors had not received adequate training and guidance. The final case I want to mention is where a child actually fell through a gap in railings from a viewing point watching a Christmas parade. She fell 3 meters, fracturing her skull. One of the spindles had been missing for up to 18 months. Again, there was no risk assessment or control measures in place for the event and inadequate training of staff. The council in that case received, again, a substantial fine of £300,000.
Thank you for that, Ridwaan. And in relation to occupational disease, I think you mentioned housing associations. The effect of failings in relation to disease is not necessarily immediately obvious. So could you just give us some insight in relation to that?
Yeah, the prosecutions have been against housing associations and a council from use of vibratory tools, where a number of employees went on to develop hand-arm vibration syndrome, HAVS, working in the ground maintenance, construction, street care teams, where they would be expected to use tools on a daily basis. There were findings of a failure to prevent or reduce exposure, provide information, instruction, training, not having health surveillance systems in place, and a failure to maintain work equipment. The 3 organisations actually were sentenced to fines of £80,000, £100,000 and £600,000 respectively. So quite substantial fines there.
Yes, indeed, and especially for housing associations that are not as large an organisation as a local authority, it really is a substantial fine. Just one final question, Ridwaan. You mentioned schools, so what health and safety prosecutions have we seen in relation to those organisations?
Last October, council was sentenced following an incident where an assistant head teacher was assaulted by a pupil, resulting in life-changing injuries. The HSE found there were significant shortcomings in the measures regarding violence and aggression posed by pupils to others. There was a lack of training of staff to deal with violent, aggressive pupils, which did not expose them to a risk. Where the council is the employer, they must monitor arrangements its schools have in place to manage the risk of violence from pupils. This is the only case where the sentencing judge at the Crown Court was prepared to reduce the level of fine from £300,000 to £104,000 due to the impact of the pandemic on the council's revenue budgets. In a more recent sentence, an independent school were fined over £60,000 when a visitor to the school in the evening tripped over law retaining a wall, sustaining a head injury and dying 6 days later. There was a failure of the premises risk assessment in identifying the hazard. Just one final point, one lesson in all these cases we've discussed today is that they're all preventable.
Thank you, Ridwaan. Yes, a simple risk assessment in most of these cases would have avoided the significant fines that these organisations have met. Thank you very much for your insights, Ridwaan, and thank you all for listening. We hope you found our insights helpful. And if you want any further information, our contact details will appear on the screen shortly. Thank you.